Hello, friends. I am Dr. Rajendra Jagannath Khaire from Nasik. I'm working orthopedic surgeon since last 15 years in Nasik. So, friends, we all know this current pandemic has changed all the new normals for our day-to-day life. So, as far as our musculoskeletal conditions are concerned, this has become bread and butter for the regular orthopedic surgeons working for rest of the life. We all know musculoskeletal health plays a key role to keep up good mobility dexterity in an individual, along with enhancing their ability to work and actively participate in all aspects of life. Good musculoskeletal health is also crucial to maintain economic, social, and functional independence across their life course. Physical activity has a crucial role in reducing the risk of other non-communicable diseases, and it can also be achieved with adequate musculoskeletal health. Impaired musculoskeletal health can lead to acute and chronic pain, causing physical limitations proceedings in loss of participation and withdrawal from usual social, community, and occupational activities, further decreasing the quality of life and well being, including mental health too. Impaired musculoskeletal health can lead to substantial personal, community, and social consequences, particularly in older people. A strong relationship between painful musculoskeletal conditions, lack of physical activity, and resulting functional decline, frailty, loss of well being, and loss of independence, as well as depressive symptoms, as this has been seen in various several epidemiological studies. An individual with an arthritis and musculoskeletal disorders is sure to be better active than an individual without arthritis. Thus, a lack of regular physical activities emerges as the most prevalent risk factor associated with functional decline. Most importantly, impaired musculoskeletal health causing reduced physical capability like grip strength, walking speed, chair rising, and standing balance has been frequently linked to increased mortality. Thus, a weak musculoskeletal health is a key component of frailty. If you see to the impact of this musculoskeletal health on day-to-day life, is now recognized as globally with an increase in the morbidity and mortality related to it. Good musculoskeletal health is crucial for maintaining an active, productive, and prolonged lifespan. With an increase in the global retirement age, maintaining good musculoskeletal health will become increasingly important for older workers as many occupations and work-related activities are associated with musculoskeletal disorders like low back pain and shoulder problems, what we see in day-to-day practice. Thus, it is important to identify and implement effective interventions for people with musculoskeletal conditions to remain productive throughout their life. High income countries observe musculoskeletal conditions to be one of the major causes of work loss, early retirement, and loss of retirement wealth. While developing countries see musculoskeletal conditions to have a major impact on livelihoods, thus, reduced musculoskeletal health results in reduced productivity and economic loss to the society at all levels. Since musculoskeletal conditions are chronic, painful, associated with disability and social disengagement, frequently causes mental health impairments such as depression and anxiety, as well as other comorbidities. Physical and mental aspects of quality of life related to health is known to be greatly impacted in persons with multimorbidity. Unfortunately, this impact is even greater when there is an associated musculoskeletal conditions. Now, if you see to the burden of these diseases related to musculoskeletal conditions, the non-communicable diseases now account for the most of the global burden of disease with musculoskeletal conditions, and musculoskeletal condition being the leading contributor. Developed countries well recognize the transition of burden to long-term disabling conditions. However, low and middle income countries are now demonstrating the enormous future impact from musculoskeletal conditions such as osteoporosis and low back pain, driven by population growth and aging. Since age is the commonest risk factor for musculoskeletal condition, it is estimated that by 2050, there will be a 5-time rise in the people over 40 years living in developing countries, contrasting the wealthier countries. Additionally, obesity, another important risk factor for many musculoskeletal conditions, is also hypothesized to rise dramatically in developing world over the coming 2 decades. Furthermore, increased use of motor vehicles is not only reducing physical activity, but also increasing the number of motor vehicle accidents and resulting musculoskeletal traumas and disorders. That leads to a huge burden on the economy of the particular countries. If you see the role of physical inactivity and sedentary behavior, sustained and systematic urbanization in developed countries has led to sedentary behavior among the people, particularly younger ones. The rapid growth of legions of video games, social media, movie streaming, and binge watching seems to be the prime contributor. This surge in sedentary behavior is not only a major risk factor for many chronic diseases, but also recognized as a substantial global economic burden. Increasing physical activity and optimizing exercises as recommended by Arthritis Research UK, increasing physical activity and optimizing exercises as recommended by Arthritis Research UK versus Arthritis and WHO is an optimal way to improve musculoskeletal health. Evidence show that the effects of sedentary lifestyle, that is the desk jobs, can reduce by a small amount of activity every day. A recent meta-analysis utilizing the data of more than 1 million individuals concluded that 1 hour of moderate level activity daily can eliminate the increased risk of death associated with 8 hours of sitting. Thus, a moderate level of physical activity remains a key requirement for healthy aging and maintaining musculoskeletal health. Sedentary behavior is a major contributor to obesity and type 2 diabetes. Likewise, obesity is also a major contributor to the development of progression of osteoarthritis, with several epidemiological studies confirming the link between adiposities and joint degeneration. Evidence suggests that increasing the level of physical activity will not only increase the musculoskeletal health, but also decrease the risk of suffering from obesity-related diseases such as diabetes. Nearly 2 hours per week of moderate physical activity, or about 20 minutes of daily or any kind of physical activity like brisk walking is recommended by WHO, that is World Health Organization. These exercises elevate heart rate and are known to be associated with lower lifetime risk of cardiovascular diseases. Apart from rendering musculoskeletal health benefits, improvements in achieve a low intensity physical activity like walking. Exercise is now widely prescribed for the rehabilitation of musculoskeletal injuries and is used as a preventive health measure, is now only widely investigated with guidelines around the type, frequency, and duration of activities being considered. Low back pain and neck pain can be benefited by staying active and exercising regularly. Group exercises program or weight loss supports can be considered. To reduce the incidence of falls, balance and strength training, home hazard assessment, participation in falls prevention programs, and getting involved in activities like gardening, dancing, etc., can help to a very good amount. Osteoarthritis has been shown to be benefited from activities and exercises that improve muscles and aerobic fitness, like walking, swimming, pilates, weight loss support, and can be rendered if required. Aging is inevitable, but it can be made easy and healthy with the help of exercises. Exercises renders many benefits to aging body, including reducing the manifestations of aging, especially the aging phenotype of elderly. A recent systematic review concluded that physical exercises renders a positive impact on muscle mass and function in healthy subjects aged above 60 by improving their muscle mass, by increasing their muscle mass and their performance, by increasing the ratio of type 1 and type 2 muscle fibers, and also increasing the cross-sectional area of type 2 muscle fibers. An European study from the clinical and economic aspects of osteoporosis, osteoarthritis, and musculoskeletal disorders task force recommended higher protein intake in combination with physical exercise in post-menopausal women at risk of developing a menopause-associated musculoskeletal disease like osteoporosis. Physical exercise programs improve strength and balance in aging women with osteoporosis. Additionally, fragility factors risk associated with osteoporosis can be decreased by following an exercise program, and exercise increases bone density and reduces inflammatory markers. Thus, having an active lifestyle from an early age and following recommendations for exercise could benefit for women of almost all ages. Furthermore, exercise and mechanical loading have a positive impact on the molecular, cellular, and tissue levels. Like with aging, the potential of cell proliferation and number of stem or progenitor cells decreases in tendons. Exercises loading can induce an increase in tendon collagen synthesis, thus increasing the tendon strength. So friends, physical exercises and mechanical loading also have a positive role in maintaining cartilage and bone health. Moderate exercises could also enhance the quality of tissue produced during the healing of injured tendons. A surge in the sedentary behavior and unhealthy diets have caused the global obesity epidemic, along with sharp rise in the incidence of type 2 diabetes. These are further great risk factors for cardiovascular as well as neurodegenerative diseases, which further complicates the management of musculoskeletal diseases. Obesity is an important comorbidity for many musculoskeletal conditions and is clearly related to development of osteoarthritis, one of the commonest musculoskeletal health issues. Thus, strategies aimed at reducing obesity in adults will reduce the occurrence of osteoarthritis, thus can elevate some of the pain of the conditions. Interestingly, obesity is also one of the most modifiable risk factors for osteoarthritis. Exercises and weight loss have benefited overweight and obese adults with osteoarthritis in many clinical trials. Thus, combining modest weight loss with moderate exercise can provide the best overall improvement in symptoms of pain and joint function. Now, if we see the consequences of childhood obesity and physical inactivity, so lack of physical exercises in childhood causes childhood obesity, which further leads to musculoskeletal pain in later life. Thus, reducing obesity in these children by encouraging physical activity will also reduce the risk of developing musculoskeletal pain in later life. Furthermore, consumption of unhealthy diet and sedentary lifestyle is contributing to the increased incidence of childhood obesity. Low in nutritional value and high in caloric content foods further contributes to the obesity epidemic, which may also play a role in higher prevalence of type 2 diabetes and cardiovascular diseases, which are further exacerbated by lack of fitness and by inactivity. Yes, diet is inevitable and important part of healthy living. A 3-year follow-up study, including about 400 adults, showed that diet high in potassium that are from fruits and vegetable intake reduce the amount of muscle loss in adults over 65 years of age. Dietary flavonoids intake from fruits and vegetables is also known to be positively correlated with good bone health, that is, good bone mineral density and bone resorption in perimenopausal women. Improving the diet of osteoarthritis have also shown a great benefits. Vitamin D, calcium, particularly protein consumption, have been shown to optimize muscle, bone, and functional outcomes in older people, reducing fall and fractures. Calcium and protein synergistically optimize bone health. Thus, dietary strategies for improving musculoskeletal health should include consumption of long chain fatty acids, vitamin D, and vitamin K that helps in bone and cartilage mineralization and decrease blood cholesterol. Antioxidant rich diet may benefit athletes by improving tissue repair. Sarcopenia in elder people can be benefited by combining exercises with a dietary supplement of whey proteins fortified with vitamin D, and it increase muscle mass and strength. So friends, overall, if you see nutshell of this topic, maintaining a good life needs a good health. So your dietary supplement along with your daily exercising protocols will keep you fit and healthy. I thank you everyone for listening it patiently. And I thank you, Dr. Reddy's and all the associated fraternity for including my lecture in this topic. And also congratulating Dr. Reddy's for taking this initiative for awareness in local. Thank you. Thanks a lot.